Clear!
Hi, I'm the clinical informaticist. How can I help you?
Nice to meet you. Yes. I'm looking for an order set, something that will allow me to work up my patients, treat their disease, admit them, take care of them while they're an inpatient, and then discharge them all in the same order set. Oh, and I want the whole thing to be pre-clicked so that for me, I just want to be able to click once and all of that will be taken care of. Do you think you can do that for me?
How are you going to know if the workup results in the right diagnosis to treat the disease? And what about med reconciliation? Are you worried about reconciling meds at transitions of care?
No. Trust me, I've been doing this for 20 years. There must be a way to do this. You know, my cousin has a son who just graduated from college, and he's very good with computers. He hooked up cable at home, and very smart young man. Maybe we can get him to come in and make this happen with one click. It is a computer, right?
Oh, yeah. Yeah, good to hear he's good with computers, but I'm talking about med reconciliation. That's the process of evaluating the patient, looking at their home med list, looking at their active med list, and then deciding if the patient still needs those meds. That's hard to do if we have one order set covering before and after the entire hospitalization.
These computers. No. What? I need to be able to do it with one click. That's how my phone works. I just press one button and the whole thing is taken care of for me. That's what I'm looking for.
Always remember, no computer is a substitute for good clinical judgment and great clinical care. All right, so now some take-home points just to review. First take-home point, remember that you can help reduce clicks by designing your order sets around very common, clearly defined, discrete, and well-defined ordering scenarios. Again, reducing clicks through good definition, common, clear, discrete, and well-defined. Keep that in mind. Take-home point number 2, remember that order sets are made of one or more of 15 or 16 different ingredients that go into making the order set. That's called order types. Those common order types include things like ADT orders, code status orders, activity orders, diet nutrition orders, blood bank, respiratory therapy, nursing, IV fluid, medication, laboratory, radiology, diagnostic orders, special orders, consult and referral orders, discharge education orders, and in some outpatient areas, order type number 16 is actually just charges, but they're often used in outpatient areas and ambulatory procedure areas. Next, take-home point number 3, remember good order sets typically come in one of 10 different flavors. This is so key to deciding on those discrete, clearly defined ordering scenarios. So this is a handy way of kind of categorizing them. Admission order sets, transfer order sets, discharge, workup for working up a chief complaint, treat to treat a new diagnosis, monitor to monitor an established diagnosis, prep and post to prepare and recover from a surgery, panels to standardize common scenarios for use in other order sets, and finally protocols, which we'll talk more about in a future video. Bonus question, if an order set is a collection of panels and orders are used to standardize and expedite the ordering process for a common clinical scenario, then what exactly is a clinical pathway? The answer, a clinical pathway is a collection of order sets used to standardize inpatient care for a common diagnosis or procedure. All right, thank you very much and stay tuned for our next video.